If you have been scrolling through YouTube today, trying to decide if to go back to school to become an NP, I'm sure that you've seen videos such as, is becoming an NP worth it? I wasted my time. Why you shouldn't become an NP? And honestly, it hurts my heart because I've been an NP for almost 17 years and I've loved it. But what those videos don't talk about is really how do you decide what type of NP to be, or even if you should go back to school to become an NP. So before you apply to any school, here are 3 questions you need to ask yourself. The first question is this something you really want to do, or are you just doing it because you're frustrated? Let's be real. Burnout is a real concept in nursing. We could get tired, exhausted from doing shift work, changes in the hospital, patient scenarios, patient violence, and it can make us think that we should just run from the bedside and do the next obvious thing that most NPs or most nurses do, which is become an NP. However, if you let frustration push you into decisions, then you'll never be clear about exactly what you want. Because honestly, leaving the bedside doesn't mean that things get easier or better. As a nurse practitioner, you're responsible for diagnosing, for prescribing, for liability of what you do with your patients in any sort of practice that you do. And in addition to that, many times you get tasks that you wouldn't deem an NP role just because you're really good as a nurse and you can really prescribe and diagnose patients. So it's understanding that becoming an NP is not just escaping bedside, but it's a different job. It's not a promotion, and it's not something you should go into just because everyone is doing it. The truth is, frustration can make you want to change something fast, but that doesn't always mean it's the right thing to do for you. So let's be clear to ask, why are we moving into NP school? Is it from frustration, or is it because we really want it? But to really dive in, let's get a bit more specific. My second question to you is, what kind of work do you actually enjoy? See, when I was deciding to become a nurse practitioner, everyone was doing primary care, and I thought that's what I wanted to do. I loved kids. I knew from a young age I wanted to be a pediatrician and ended up in the nursing world. And I was like, yep, that's perfect. And so as I was working bedside and critical care, I started exploring what primary care looked like. And it was seeing multiple patients a day, talking about vaccines and preventative care. At that time, it was boring to me. It wasn't exciting. I even explored previously midwifery because I said, oh, I like pediatric patients, but I didn't want to really deal with pregnant people. And then I thought, well, maybe I'll just stay in critical care. But I was like, I don't really want to take care of sick people all the time. And so I landed on a healthy in-between, which was pediatric acute care / chronic care. And what I realized about myself was that I wanted intensity, but I wanted flexibility. I wanted a standard skill set that could kind of be applied to various areas. Now, I'll tell you, if I had followed the crowd, I might have built a career that just didn't fit me, and I would have been frustrated. So here's how I loosely think about the different specialties. Primary care, you think continuity of care, preventative care in an office setting. Acute care can be 2 things. It can be subspecialty, working in a hospital, or subspecialty, working in outpatient. Either way, it's patients who are acutely ill with some disorder that need help. You can think about psych. Those patients can be inpatient, you can have an outpatient practice, but it requires depth and emotional labor, where you're listening to stories of people and helping them. And if all of that seems just too confusing, here's a tool you can use. If you pause this video and take just 10 minutes, find a quiet area, you can find a piece of paper or receipt, anything that you have, maybe your phone. And here are the 2 things I want you to explore. If you think about your current role, what you're doing right now, what do you like most about it? What gets you excited about it? What do you enjoy when you go to work? And then below that, I want you to write down what drains you. Just what do you absolutely hate? No judgment. And if you literally sit down for 10 minutes, and make this list and then look back at it, it will truly help you decide what kind of role you like, and maybe find roles that center around mostly the things you like to do, at least 70% of the things that you like to do, versus a role that may have 50-50, or worse yet, 30% of the things you like and 70% that you don't. Because really and truly, whatever's trending right now in terms of specialties for NPs just may not be the best fit for you. And lastly, have you really explored all your options? The true beauty of nursing is that you can literally do anything with your degree. We are taught such critical thinking skills. You can usually plug them in anywhere. There are leadership roles, there's informatics, there's quality improvement where you get to improve processes, there's entrepreneurship where you can build a business, there's education where you don't need a PhD, but you can help teach a course or work for a corporation that helps nurses pass their NCLEX exam. I did that. Becoming an NP is one path, but it's not the only path that you can take. So if at any point as you're listening to this video, and if you've been pondering the idea of going back to school to become a nurse practitioner, because it feels like the default thing to do, just pause. There are so many more options than you think. And I'm definitely not anti-NP or telling you not to go to NP school or DNP school. I just don't want nurses defaulting into roles. I want us choosing roles that actually fit how we like to work, the things we like to do at work, and how we want to live our lives. I truly believe that if we actually were intentional about how we were choosing our jobs, there would be less burnout, because we'd be more in line with the type of work that we want to do versus just doing it and showing up for a check. Honestly, I love seeing nurses grow in this profession, and it's needed. And I just want to encourage you for number one, even looking for advice right now on what to do about school and how to approach it. And I would tell you this, after doing this exercise, the 2 questions I told you to think about, or even the 3 questions in total, if it fits you, if it's still a fast yes, I want to become an NP, then go for it. But if there's any hesitation, make sure that you're making the right decision for you and not just the next logical step. So drop in the comments, which of these 3 questions were the hardest for you to answer right now? And if you like this information that I've shared about nursing career paths and how to determine what NP specialty you might want to venture into, then hit the subscribe button and stay tuned into the next video where we dive into this topic more.